Now, the priority for shots in Ontario has been for medical professionals and those in long-term care. But so far, the majority of inoculations have gone to those in urban areas. So how long will doctors in rural areas have to wait? And with a vaccine shortage on the horizon, will that take even longer? Well, our next guest is expressing his concern about all of this. Dr. Alan Drummond is an emergency room physician in Perth, Ontario. He joins us right now. So, Dr. Drummond, thank you for being with us today.
Thank you for having me.
So listen, I understand that you right now have no timeline for when emergency and hospital staff will get the vaccine in your area, and certainly this is being echoed in smaller areas, rural areas across Ontario. What exactly have you been told?
Nothing. In short, that we understand, entirely that there are people in vulnerable communities, vulnerable individuals who are in dire need of vaccination to help sort of stem the tide of the pandemic, such as long-term care, Indigenous populations, congregate settings, and people who are socially disadvantaged. We also understand that there has been this call for frontline healthcare workers, but somehow that has managed to morph into something other than frontline healthcare workers. Keep in mind that 50% of the emergency care delivered in this country is delivered by physicians and nurses in rural communities. Also keep in mind that Canada is now currently short 2,000 emergency physicians. And so we are a very vulnerable and yet integral part of the healthcare system. If emergency medicine fails, the pandemic plan fails. And quite frankly, it's been quite appalling to see politicians, PR people, hospital administrators, and physicians on the back lines of healthcare, such as psychiatrists, physiatrists, doctors on maternity leave, receiving vaccinations, while in rural communities, paramedics, emergency nurses, and emergency physicians have not even been shown the respect of even a direct conversation as to when we might expect the vaccination. It's kind of like we're an afterthought.
I want to pick up on a point that you mentioned there, that this idea that 50% of healthcare in the province is actually being delivered in smaller areas, rural areas of Ontario. So talk to us about the risks then, if you wouldn't mind expanding on what you're alluding to, of what failing to vaccinate healthcare workers would actually mean for a rural area, perhaps even using experiences in your own area.
Sure. So I think there's a misunderstanding or misinformation with respect to the fact that, and we understand that there are people in red zones that are critically affected, but COVID is in many communities across this province, across this country, including my own. I've admitted patients with COVID in my general practice. I have patients with COVID. My brother-in-law in a neighboring community 30 kilometers down the road resuscitated a 29-year-old with COVID. So, it's very much here. And, in a rural community, if one physician or one nurse or a paramedic gets sick with COVID or is quarantined, the whole service is threatened because we do not have, redundancy in terms of our health human resources. So it's vitally important, I think. I mean, nobody gets into an ICU, a COVID ICU, without first being assessed and managed by a paramedic, an emergency nurse, and an emergency physician. So, in order to get from home to being intubated and ventilated in an ICU requires you to go through those three levels of assessment in the emergency care system. And there's really been like a lack of communication, or lack of transparency, and certainly a lack of accountability when we see administrators getting vaccinated before people in small and rural communities on the front lines of healthcare.
I'm wondering what type of reaction you're getting when you share this information with people in your community. We know, for example, that officials have a very hard time trying to attract new doctors to go into smaller centers, rural areas. So what is the reaction when from your patients and from people in your community when they hear that their own frontline workers are not being prioritized for a vaccine?
Well, I think it sends quite a message, actually. I think, rural Canadians represent about 20% of all Canadians. My population, the people I serve, the people I look after, are socially disadvantaged. They have high rates of comorbidities such as obesity, hypertension, congestive heart failure. And subliminally, for the healthcare workers, it sends a message like we're not actually the healthcare heroes we were deemed back in February when we were sent into the front lines without adequate protection from PPE. It sort of suggests we're not healthcare heroes at all, but rather just cannon fodder. And for our patients, our rural patients who are often left behind in the grand scheme of healthcare delivery in this country. The fact that their frontline healthcare workers are not being vaccinated also sends a message to them that they probably shouldn't exactly hold their breath for vaccination anytime soon, even though they are a high-risk population.
So you're now taking the issue public. You're speaking to us on national television. What do you hope this conversation achieves?
Well, I think I'm echoing what the Emergency Physicians National Association called for, which is just greater transparency and better communication. Nobody's asking to jump the queue here. We all understand there's a vaccine shortage and our population's at much greater need. But from the very beginning of this pandemic, it has been marked by a lack of direct communication with frontline healthcare workers, confusing messaging, and a total lack of transparency, which is in evidence yet once again with the vaccine rollout. So explain to me how a psychiatrist doing Zoom meetings in Ottawa should somehow get access to a vaccine when an emergency physician in Niagara or Sault Ste. Marie or Thunder Bay or Smiths Falls is left wondering, and worrying as to when this should eventually arrive.
Dr. Alan Drummond, thank you for being with us today. Appreciate it.
All the best. Thank you very much.
And to you, do take care. Thank you for that. And Dr. Drummond is an emergency room physician in Perth, Ontario.